Are addicts born or are they made?
It depends partly on terminology. An individual has about 50% of the underlying cause of their addictive disease based upon genetics. The other half is based upon some environmental trigger. So it's very similar to diabetes. If you have identical twins, one of them may have type 1 diabetes, juvenile diabetes, while the other one does not. Why? Because the underlying genes are only part of the reasoning. That's true with addictive disease. So you can have the genetics, which is the first part that you need. You can have the environmental trigger, which is the second part that you need. But you need one other thing. The third component is you must live in a society that promotes or otherwise instigates the initial use of the substance. Because if you're never exposed to it, even if you have the genes and the environmental trigger, you won't have any of the heartache from it.
Right.
And we know this, everything that Dr. Gitlow just said, we know a lot about this from really decades of research, although there's some recent research that informs the question too. These are things like adoption studies or twin studies, where you can sort out what might be attributable to exposure in the social environment, in the family, versus whether something was inherited. That is, was it in the family, a family member? There are animal studies where they have rats who are exposed to a better social environment or a worse social environment. And those who are in the worst social environment are going to be more likely to use the available substance. And in people, we find that kids who are exposed at an earlier age, let's say to alcohol, have a much higher chance of developing problems or consequences of alcohol once they reach adulthood. And the last thing I'd say about this sort of genetic and social piece is that that addiction is actually more biologically based and more genetic than many other conditions that we talk about every day as medical diseases, like diabetes and high blood pressure and heart disease.
There's a low perception of risk around marijuana among young people. This reader says here, so maybe is in Colorado. And finally, is it true that alcohol is more harmful than weed?
The major study of marijuana use in young people versus perception of risk demonstrates an inverse correlation. In other words, the lower the risk the individual perceives is due to the drug, the more likely they are to use it. So if the discussion is around the safety of the substance and individuals take that information in and believe that information, their likelihood of using the substance is significantly higher.
And let me even expand that to prescription opioids and to alcohol. So the general perception is that marijuana is relatively safe, especially if it's sanctioned by the state, especially if it has the word medical tied to it, right? Prescription opioids, in fact, are approved medications with totally appropriate indications when used in the right circumstances. Right. And so kids think if they're medications that come in a bottle, they must be safe. Right. And alcohol is so culturally ingrained that again, people have a general perception of safety, and scientists even often don't like, this is what Dr. Gitlow referred to earlier, might not believe some studies that suggest harm or that don't find even some benefit. So I think this is a general theme that as in society we talk about these substances as being safe or sanctioned or safer or legal or medical, that there is going to be more use. And then if there's more use, there's going to be more addiction